Hey everyone, today we're going to talk about something really important, bipolar disorder. We're going to break it down using some great info from the Westminster Clinic to get a much clearer picture of what this condition is all about. The source material kicks things off with a really powerful idea, calling it a storm. And I think that's just the perfect way to look at it, because it immediately tells you we're not just talking about a dry clinical label. We're talking about a real lived experience, trying to navigate these huge, unpredictable shifts inside your own mind. All right, so first things first, let's really dig into what this storm is made of. What it is, and maybe even more importantly, what it isn't. And this right here is a super important point. We're not just talking about having a good day and then a bad day. I mean, we all have those, right? No, the source makes it really clear. This is a medical condition. We're talking about distinct episodes that are way more intense, way more disruptive than just regular moodiness. So you can really see the two sides of the coin here. You've got the lows, the depressive side, and this isn't just feeling sad. It's deep exhaustion, a sense of hopelessness, completely losing interest in things that used to make you happy. And then on the flip side, you have the highs. And again, this isn't just being in a great mood. It can be this wired restlessness, thoughts that just won't slow down, and making impulsive choices that, well, they can have some pretty serious consequences. So you might be asking, well, where does this even come from? And the truth is, it's complicated. It's almost never just one single thing. It's usually a mix of factors. Genetics, brain chemistry, and then life events like trauma or a ton of stress can play a big role. And that complexity is exactly why it's so important to get professional care. Okay, so that leads us to a really practical question, right? How do you know if what you're seeing in yourself or someone else is something that needs professional support? Let's talk about how to recognize the signs. This is the big one, isn't it? What's the difference between just being moody and something more? The secret, really, is all in the patterns. See, the key here isn't looking for one bad day or one super energetic day. It's about a pattern of these episodes that really disrupt life. We're talking about an intense sadness that sticks around for days or even weeks, or periods of crazy high energy where you hardly sleep at all but somehow don't even feel tired. And these shifts, they really start to affect the big things in your life, your work, your studies, your relationships. It gets to a point where it just feels unmanageable. And that's exactly why spotting these patterns is so, so important. The Westminster Clinic really stresses this. Getting help early, getting a diagnosis, and starting treatment, it can make an enormous difference. It's all about taming that storm, reducing how intense the episodes are, and just finding that path to stability much, much sooner. All right, so if you do seek help, what does that path to stability actually look like? Well, let's get into it. Let's talk about what a treatment plan can look like. The good news is the first step isn't some scary, overwhelming thing. It's really just a conversation. You sit down for a thorough consultation, talk about your history, your symptoms, your lifestyle, all of it. And that conversation becomes the foundation for building a plan that's tailored just for you. And as you can see, treatment isn't just one thing. It's this whole toolkit. You've got medication, like mood stabilizers, to help manage things on a biological level. But that's usually paired with therapy, things like CBT, to help you build coping strategies and spot your triggers. Then there's lifestyle stuff, creating routines for sleep and nutrition. And really importantly, getting family involved for support. It's a full-on, comprehensive approach to finding that stability. So, all of this, the diagnosis, the treatment plan, it's all pointing toward one clear goal. And that's what we'll talk about now. What it looks like to find that balance and to realize that a stable, happy life is totally possible. Which brings us to probably the biggest question on anyone's mind when they're facing a diagnosis like this. It's the question that's all about hope, isn't it? It's about the future. And the answer, straight from the source material, is a huge, resounding yes. And this is so, so important to hear. With proper, consistent care, people absolutely lead full, productive lives. They have careers, they have strong relationships. This diagnosis does not have to be the thing that defines your future. Of course, nobody gets through something like this completely on their own. So that raises another big question. What about family? What role can the people closest to you play in all of this? Well, it turns out they can play a huge role.
A good support system is just invaluable. Family and friends can actually become part of the team, right? They can help spot the early warning signs of an episode, they can offer that crucial support when you need it most, and they can even come to therapy sessions to learn how they can help in the most constructive way.
So, when you boil it all down, the biggest takeaway here is really a message of hope and empowerment. Yes, bipolar disorder is a serious condition, but, and this is a big but, with the right approach, it is absolutely a manageable one. And I want to leave you with this final thought from the Westminster Clinic. It's such a powerful reminder that no one has to go through the storm all by themselves. The real goal here isn't just about managing symptoms. It's about finding your way to a lasting sense of stability and ultimately peace of mind.